So, let's start with our review sa CT and MRI. So, first question. So, sagot na pala. So, which of the following term describes the storage of CT images on long-term storage such as cassette tape, magnetic tape, or optical disc? That is, sorry. So, ito yung keyword natin, long-term storage. So, that is archiving. Okay, so when we say archiving, that is for long-term storage. So, ang gamit before were cassette tapes, if naabutan nyo pa, sa mga nakaabot pa. Magnetic tapes, ito yung ating mga Betamax, VHS before. And optical disc, ito na yung ating mga CD, DVDs. Pero ngayon, nauso na rin yung ating flash drive and external hard drives. Next, it is the result of a variety of different tissue. So, different tissue types being contained within a single voxel. So, this is the motion artifact. So, this artifact, it contains different tissue types. Tapos, nakapaloob na siya sa isang single voxel for volume element. And that is because of the motion. So, it results to motion artifact. So, pag sinabi natin partial volume artifact, so partial volume artifact is the result of averaging. So, result of averaging the linear attenuation coefficient in a voxel that is heterogeneous in composition. So, kumbaga, iba-iba yung attenuation coefficient or iba-iba yung Hounsfield unit ng structures. Tapos, kinuha lang natin yung average and sometimes it can result to partial volume artifact. Kasi hindi na siya yung true image kasi kinuha lang natin yung average. Okay? So, partial volume artifact. Ang beam hardening naman, it is cupping. So, may mga questions ako din after this, about beam hardening. So, cup, C-U-P. Next, which type of artifact usually occurs in the soft tissue regions between large bony structures and also results in decreased image intensity that does not represent the tissue. So, this is the beam hardening artifact. So, again, sometimes it is also called beam cupping. So, it is an artifact that occurs or appears in the soft tissue regions between large bony structures. Okay, so kapag may mga large bony structures and sa gitna ng between these large bony structures, may soft tissue, so it results to beam hardening artifact. Next, which of the following is determined by the physical collimation. So, physical collimation of the incident photon beam with two lead jaws. And that is what we call the slice thickness. So, slice thickness determines the physical collimation of the instant photon or the instant X-ray between the two lead jaws. So, yung two lead jaws natin, ito yung collimators na ginagamit natin sa CT scan. Next, it determines how tightly the helix in a helical scan is wound o kung paano siya kinabit. So, gaano ka-tight yung pagkakabit ng helix in a helical scan. So, that refers to pitch. Next, Which of the following is synonymous or parang the same ang definition or ang meaning to incremental scanning? So, synonymous to incremental scanning, that is axial scanning. So, wala tayong term na pitch scanning. So, incremental scanning is a type of file scan or axial scanning. It's a type of file scan which the application only scan files that have been modified. So, yung mga na-modify na-scan, so ito lang yung pwede niyang pagkagamitan. Okay? By default, incremental scanning is enabled and the application performs a full scan at the first task run. It is for axial scanning or incremental scanning. Next, it is determined primarily by the number of photons used to make an image. So, ang dami ng X-rays, ang dami ng photons used to make an image, and this is also reduced by increasing the voxel size or decreasing the section thickness. This is noise. So, the more number of photons used, less noise. Okay? So, para rin siya sa ating screen film radiography. Pag mas mataas ang MAS, so higher MAS, it also results to higher number of X-ray photons. So, it results to less noise or yung ating quantum model. So, ganun din siya. Number of photons determines the noise. Kung mataas ba ang noise or mababa. So, we can also reduce noise by increasing the voxel size, or we can also reduce the noise by increasing the section thickness. So, it depends kung ano yung gagamitin mo na parameter. Either you increase with the MAS, or you increase with the voxel size, or you increase with the section thickness. Next, also known as the tissue or volume element, determined by the product of the pixel size and the thickness of the CT scan slice. So, this refers to voxel. So, voxel is equal to pixel size times CT scan slice. Next, what is the minimum anode heat capacity of a CT X-ray tube? So, that is 500,000 heat units. Yung ating general X-ray tube, the maximum heat capacity, maximum niya na. Maximum is 350,000 heat units. So, eto, minimum pa lang ng CT is 500,000. Therefore, so this means that the CT scan can accommodate much higher heat capacity, and also, meaning we can also perform several examinations na sunod-sunod. Kasi nga mas mataas yung kanyang heat capacity. What type of CT scanner is described when the radiation detection is accomplished through a fixed circular array of detectors that contains as many as 1,000 individual elements. So, 1,000 detectors or detector elements, detector crystals. And this is the fourth generation CT. So, second generation, ang inyo ding ang tatandaan dito is uses a bow tie filter. The third artifact, ang pinaka-common naman sa kanya na madali siyang identify is the production of the ring artifact. First dyan naman, the least efficient that uses a pencil beam array. Next, age closure of anterior fontanelle. Kailan nagsasara? Usually, ang ating anterior fontanelle. Anterior fontanelle is also termed as bregma. This is the last fontanelle that closes, and it closes at about 1 year and 6 months, or about 18. And this is the last fontanelle that closes. Next, age closure naman of posterior fontanelle. Posterior fontanelle is termed as lambda. And it closes naman at about 4 months. Medyo mas mabilis siya. Yung pinakamatagal again is yung ating anterior fontanelle. Next, site of hemorrhage that commonly cause aneurysm and trauma. So usually it is found at the subdural. So usually it is the site of hemorrhage caused by aneurysm and trauma. Next, abnormal network of arteries and veins with no intervening capillary bed. So, abnormal network of arteries, no intervening capillary bed, that is AVM, or arteriovenous malformation. Lacunar infarct naman, these are non-cortical infarcts caused by occlusion of a single penetrating branch. So, occlusion naman siya, caused by occlusion of a single penetrating branch of a large cerebral artery. While cerebral infarction, this is a pathologic process resulting from necrotic tissue. Necrotic tissue in the brain, which results to cerebral infarct. While the cavernous malformation, or specifically the cerebral cavernous malformation, these are groups of tightly packed abnormal small blood vessels. So, tightly packed abnormal small blood vessels with thin walls. Next, it is caused by occlusion of penetrating cerebral arterioles, and those are lacunar infarct. So, di ba yung sinabi ko kanina sa previous slide, occlusion, that is lacunar infarct. Next, appearance of acute hemorrhage and CT, so that is hyperdense. So, kung sa ultrasound, ang tawag natin sa mga structures kapag nagde-describe tayo is isoechoic, hyperechoic, hypoechoic, anechoic. Sa CT scan naman, ang tawag natin is hyperdense, hypodense, isodense, and hyperdense. Pag sa MRI, ang tawag naman natin is hyperintense, hypointense, isointense. Pag sa X-ray, din sa radiopaque and radiolucent. So, pag acute, meaning it occurred immediately or within a matter of short time. So, hyperdense ang appearance ng hemorrhage. Pero pag chronic, it appears hypodense. So, hyper pag acute, hypo pag chronic. Next, so long head for abnormal head, that is dolichocephaly. Brachy is short head. Meso is normal head. While trigonocephaly is the premature closure of the metopic suture. Premature closure of metopic suture. So, pag sinabi natin metopic suture, these are sutures that separates the two frontal bones. So, two frontal bones. So, sutures that separate between two frontal bones. Next is short head. So, ito yung ating brachycephaly. Next, for both heads. So, these are mga abnormal shapes ng head. So, both head is scaphocephaly. So, plagiocephaly. So, this develops when an infant's soft skull becomes flattened. Yung isang part ng skull, halimbawa sa left part ng skull, it is flattened due to repeated pressure. Halimbawa, lagi siya napipress, so nag-flatten yung part na yon, halimbawa yung left side ng kanyang skull, that is plagiocephaly. Pag sinabi naman natin scapocephaly, so narrow and long. So, para siyang boat. Narrow and long. Pag turicephaly naman, so it is a type of cephalic disorder where head appears tall with small length and width. Well, small length and width. Pag acrocephaly, so this is also termed as tower head. So, para siyang dome shape skull. Next, pointed head. So, pointed head is also termed as all of this. Have pointed head. So, acrocephaly, so pointed head, oxycephaly, and toricephaly. They are pointed head. So, pag sinabi nating oxycephaly, this is the other term for toricephaly. Pareho lang sila. Next, the wobble of the rotational axis of a spinning body about a stationary axis that describes the cone is termed as rotation on an axis. And also yung isa sa mga keywords yun din is wobble. So, it precesses. So, it is precession. Next, frequency. Frequency at which a nucleus precesses is proportional to the magnetic field. So that is Larmor frequency. So Larmor frequency, so this is ito siya. W siya. So, normal frequency is equal to magnetic field times gyromagnetic ratio. So, B sub O, ito yung B sub O natin. This is the magnetic field. Magnetic field. And this one, yung para siyang gamma, this is gyromagnetic ratio. Next, a mathematical equation used for computer processing. So, may keyword na kayo dito, computer processing, tapos mathematical equation. So, this refers to algorithm. So, pixel is picture element. Tapos yung matrix naman is two-dimensional grid of pixels. And the matrix also determines the number of rows and columns in an image. And of course, you're familiar with the Hounsfield unit. The linear attenuation coefficient. The stages and development of CT machine. Platong pixel. So, stages and development. So, I think, lumabas ito sa board exam before. So, it is termed as generation. The framework that holds the X-ray tube and detector. So, ito yung major framework, yung poste ng ating X-ray tube and detector, that is the gantry. Standard slice thickness in CT scan is about 5 to 20 millimeters. Usually, yung standard thickness natin is 5 to 20 millimeters. Next, standard slice thickness that will result to high resolution. So, syempre, yung manipis. Kapag high resolution, that is 1 millimeter. So, high resolution, so that the thinnest slice possible. Also termed as memory size. This is, of course, matrix. So, memory size. So, it is comprised of pixels and voxels. And again, it determines the number of rows and columns of the image. Picture size, that is pixel. Or the picture element. Next, volume element, which is also termed as tissue volume. Of course, that is voxel. So, voxel or tissue volume. Next, the SI unit of frequency. So, the SI unit of frequency is hertz. So, watts for power? Hounsfield, of course, the CT numbers. And cycle for oscillations. Number of oscillations. A unit used to express the relative difference in power or intensity, usually between two acoustic or electric signals, which is equal to 10 times the common log or logarithm of the ratio of the two levels, is defined as decibel. So, intensity. So, acoustic. So, sound. So, that is decibel. So, again, decibel is a unit used to determine the ultrasound intensity. Next, the mathematical procedure to separate the frequency components of a signal from its amplitude. So, separate the frequency from the amplitude as a function of time is termed as Fourier transform. Fourier transformer, sa ibang book, Fourier transform. Next, which of the following factors affect noise? So, patient dose. Diba? The higher the MAS use, diba? The more X-rays produce, the higher the patient dose. Detector efficiency. Pag least efficient ang detector, kailangan nating dagdagan ang number of photons produced na kailangan natin to produce the image. And that will also entail higher technique factors, therefore increased patient dose, therefore it will also affect the noise. Diba? Kapag mas maraming photons ang kailangan, so less noise. And of course, KVP. So, therefore, all are correct. It is an imaging technique that creates a cross. So, cross-sectional, so syempre, tomographic plane using X-rays. So, alin lang naman yung gumagamit ng X-rays? Ito, tsaka ito. And then yung tomographic, syempre, may pangalan na. So, computed tomography. Regions of the abdomen that can be scanned. So, of course, regions of the body pala. So, abdomen, yes, extremities, brain. So, all can be scanned. Uses of the CT scan are as follows, except gadolinium as contrast material. So, di ba yung gadolinium natin is a paramagnetic material. Ginagamit siya sa MRI as contrast. So, ito na yun. So, ito na yung mali. Ito na yung sagot natin. So, letter A. So, ito tama to. CT scan can be used for staging of primary tumors. Also determine the operability and as a baseline of chemo. Also used for radiotherapy planning. So, instead of using simulators, CT na ginagamit sa mga modern facilities. Also, exact anatomical detail ay makikita sa CT scan when ultrasound is not successful. Next, artifact caused by faulty detectors. So, nangyayari siya kapag may problema sa detectors natin. So, those are ring artifacts. Next, unwanted sounds or unwanted signals picked up by one channel of an electronic communication systems from another channel. So, basta unwanted siya from one channel to another. So, crosstalk is crosstalk. Next, an artifact that occur more commonly when a thin slice thickness is used and with too low kV or MA. Diba? Pag masyadong mababa ang MA natin, so low number of photons produced, therefore it will result to noise artifact. Dapat kapag gusto nating iwasan na magkaroon ng noise artifact, so dagdagan, di ba? thicker or increase slice thickness, katulad ng na-discuss natin sa previous questions kanina. Next, this can give a cup appearance. So, nabanggit ko kanina, cupping siya. That is beam hardening. So, cup appearance. Next, the point of junction between coronal and sagittal sutures, that is, yes, bregma. So, bregma, that is the junction of coronal and sagittal suture. So, yung ating coronal, tapos ito yung ating sagittal. So, this one is the bregma. Ito naman yung lambda sa likod. Next. So, sagittal and lambdoidal. Okay, so, lambdoidal, tapos sagittal. Ito yung ating lambda. Next, anterior fontanelle closure. So, nabanggit natin yun kanina sa mga unang questions. That is bregma. So, it's anterior fontanelle. Pag posterior is lambda. So, next, posterior fontanelle. So, ito nga yung ating lambda. Average head. So, yung normal head natin is mesocephaly. Again, dolicho is long, brachy is short. CT scan is better than MRI in imaging of what? So, calcifications, acute bleeding, and obese patient. So, di ba, pag MRI, hindi masyadong makapag-penetrate ang ating electromagnetic field, yung magnetic field natin sa fat. So, hindi masyadong kita ang structure. Sa CT scan, so since mas penetrating yung ating x-rays, so nakikita yung structures even with obese patients. Sa acute bleeding naman, so since this is an emergency, di ba usually pag stroke patients, mas preferred ang CT scan kasi mas mabilis ang examination compared sa MRI. Kasi kung MRI yung gagamitin natin, although maganda yung detail, maganda yung resolution ng ating image sa MRI with acute bleeding, pero bago ka makatapos ng examination, baka namatay na yung pasyente mo. Diba? Kasi nga matagal matapos ang MRI scanning. And of course, for calcifications, yung mga bone structures, much better ang CT scan. Next, for vascular abnormalities, so the imaging of choice is, so sa mga soft tissues in general, except na sa mga hemorrhage na yan, which are involved in stroke, mga emergency, so CT scan. Pero normally, in general, for soft tissues, like yung mga blood vessels, vascular abnormalities, so much better, the imaging of choice is MRI. For lacunar infarct, so again, this is a soft tissue imaging. So, mas maganda din ang MRI pa rin. Next, in CT appearance, it appears darkest. So, black, di ba? Since X-ray siya, di ba? Sa X-ray natin, air is a negative contrast. So, air is black. So, it appears darkest. Okay, so last, bago tayo mag-end for this evening, The biggest organ in the mediastinum is, diba, sa gitna yan, mediastinum. The biggest organ is, of course, the heart. Okay, so we will end here this evening. So we will continue tomorrow with your CT and MRI. So far, do you have questions or concerns?